Welcome back to HealTalk, your trusted source for the latest medical breakthroughs. Today, we are discussing a massive step forward for adults living with type 2 diabetes. As many of you know, type 2 diabetes is a condition where the body struggles to control blood sugar levels. If it isn't managed well, it can lead to severe, life-altering complications like heart disease, kidney damage, vision loss, and nerve problems. To keep their blood sugar in a healthy range, many patients rely on insulin, which typically means giving themselves daily injections. But what if you could reduce those daily shots to just one shot a week? Well, the FDA has just approved a groundbreaking medication that does exactly that. It is called Awiqli. Awiqli, or Insulin icodec-abae, has just been approved by the FDA as the first and only once-weekly long-acting basal insulin for adults with type 2 diabetes. When combined with a healthy diet and regular exercise, it effectively lowers blood sugar levels. This approval is a major milestone because it reduces the number of basal insulin shots a patient has to take from 7 per week down to just 1. For anyone dealing with the daily burden of managing diabetes, this offers a much more convenient option that can be tailored to your individual routine. So, how does it actually work? Awiqli is unique. It is the only long-acting, man-made insulin, specifically U700 in the United States, that is designed to last an entire week. Its active ingredient, insulin icodec-abae, works by loosely attaching itself to a protein in your blood called albumin. By doing this, it forms a sort of reservoir in your body. Instead of hitting your system all at once, this reservoir slowly and steadily releases the insulin into your bloodstream over the course of 7 days. Because of this steady release mechanism, Awiqli provides a consistent dose of insulin and maintains a stable blood sugar lowering effect all week long, mimicking the way human insulin naturally works. Before approving it, the FDA looked closely at clinical studies involving about 2,680 adults who had uncontrolled type 2 diabetes. These patients used once-weekly Awiqli alongside other oral or injectable diabetes medicines or with mealtime insulin. The results? The studies proved that once-weekly Awiqli was highly effective in lowering levels of A1C, which is the crucial blood marker that shows your average blood sugar levels over time. Now, if you and your doctor decide that Awiqli is right for you, there are some very important rules for how to use it. You will administer it as a subcutaneous shot, meaning under the skin, using a pre-filled FlexTouch pen. You must take it on the exact same day every week. You can inject it into your thigh, your upper arm, or your belly area. However, you need to rotate the exact spot within that chosen area every time you inject to protect your skin. Never inject into skin that is sore, bruised, scaly, scarred, or damaged. Before you inject, always check that the liquid looks clear and colorless. Never mix or dilute Awiqli. Do not inject it directly into a vein or muscle, and never use it in an insulin pump. You must also use a brand new needle for every single dose, and never share your pen, or draw the insulin out of the pen with a separate syringe. What happens if you miss your scheduled day? If you miss a dose, take it as soon as you can, as long as it is within 4 days. But if more than 4 days have passed, skip the missed dose entirely and just take your next one on your usual scheduled day. As with any medication, we need to talk about safety and side effects. The safety profile of Awiqli is very similar to other long-acting basal insulins. The most common side effect is low blood sugar, also known as hypoglycemia. You need to be aware of the symptoms of low blood sugar, which include dizziness, blurred vision, anxiety, mood changes, confusion, heavy sweating, and a fast heartbeat. Never use Awiqli if you are actively experiencing a hypoglycemia episode. Other common side effects include weight gain, reactions at the injection site, itching, rash, swelling in your legs or feet, known as peripheral edema, and skin thickening or pitting where the needle goes in, called lipodystrophy. There are also serious risks to be aware of. These include severe allergic reactions, low potassium levels in the blood, and even heart failure in some people if Awiqli is taken with certain other diabetes medications. Also, Please note that Awiqli has not been shown to be safe or effective for children or teens. Because of these interactions, it is crucial that you tell your healthcare provider about all your medical conditions, especially if you have heart issues, liver or kidney problems, or if you are pregnant or breastfeeding. Tell them about every single prescription, over-the-counter medicine, vitamin, and herbal supplement you take, because many medicines can alter the effect of insulin. While you are adjusting to the medicine, avoid driving or operating heavy machinery until you know how it affects you, and avoid alcohol. Awiqli is expected to become available across the United States in the coming months. If you are an adult with type 2 diabetes, tired of daily basal insulin injections, this once-a-week option might be the life-changing shift you've been waiting for. Always talk to your healthcare provider before making any changes to your insulin routine. Thank you for joining us on this deep dive. Stay informed, stay healthy, and we will see you next time on HealTalk.